Hi, my name is Dr. Christina Rahm, and I am the president of Rahm University and the chairman of International Science Nutrition Society. Today, I'm going to talk about a disorder which really affects a lot of people. COPD is something that can really impact your life. I want to read a little bit about this disease and disorder and then tell you all about a case study that we did with the International Science Nutrition Society. COPD, or chronic obstructive pulmonary disease, is a persistent and progressive disease which makes it difficult to breathe. A lot of people think that you get COPD from smoking or from genetic issues, but the truth is there's also environmental factors that can contribute, such as pollution and such as histamines, as well as heavy metals in the environment. In this particular patient, it was a female that was 56 years old. I'm going to read a little bit about her history. The 56-year-old female had COPD and also systemic lupus. So she had two different disorders that were diagnosed. She experienced labored breathing, shortness of breath, depression, and tried a variety of treatments. They weren't working. She used a lot of medication consisting of different things from prednisone to Cymbalta to lots of different things that could possibly help her different conditions. She was stabilized in certain types of medication, but she still had a need to breathe even better. She also was experiencing significant pain and discomfort from the lupus. For the first week, the doctor gave her 1 drop of a proprietary blend, and then they went to 2 times a day. The proprietary blend was a silica, a vitamin C, and a trace mineral blend. They increased to 2 drops 2 times a day, and then finally by week 3 to 3 drops, and even progressed up to 10 drops a day in the morning and 10 drops at night. Week by week, there was a noticeable difference, and by the 3rd week, she was able to speak normally without shortness of breath. Furthermore, her pulmonologist advised her to go walking, leading to an improvement in mood and less difficulties throughout her body due to the proprietary blend as well as the traditional methods that were being used.